The sperm cell merupakan sel yang paling kecil sekali dalam badan tubuh lelaki. So kalau sel badan dia secara keseluruhan, dia ni malas, tak workout, muscle movement tak banyak, tak ada otot, they don't do anything to trigger their muscle and everything, the cellular cells all over the body pun akan pergi kepada isu demand and supply. Kenapa aku nak buat? Sebab kalau kau duduk macam tu je.
Yeah, true.
So technically the body will say like, is go into a decay position lah. I don't need to do so much, I don't need to produce a lot. Dan kalau pemakanan tak bagus, all the tools untuk pastikan bateri ni betul-betul kena charge tak ada, maka you akan dapat lah sperma yang betul-betul motile, sperma yang bergerak dengan perlahan and everything.
I would say tepuk dada tanya selera lah. Kalau you memang dah tengok gaya hidup you tak sihat, merokok dan sebagainya lah kan, and you pun tak dapat anak, you cuba, and then you don't want to blame yourself. It's very difficult to actually accept blame, but you have to start somewhere. So I would say if your lifestyle memang dah tak bagus and there are already telltale signs yang okay, you cuba tapi tak ada anak dan sebagainya, get it checked. There are ways that can help.
Medical field ni
pancreatic cancer
Bersama saya Dr. Roland Victor.
satu benda yang one of the worst stress can happen bila you makan tak sedap.
Doktor, saya punya culture kena makan nasi.
Zaman moden.
But at every second of your life you either earn or learn.
Batu Medic Show.
Hello and welcome back to Sembang Sihat bersama saya Dr. Deeban dari He Medical Clinic. Okay, so your first podcast on all things related to men's health. Anyway, so memang dah lama kita tak jumpa. So kita berjumpa balik dalam segmen podcast bersama saya. Dan hari ini saya ada membawa seorang guest. Saya rasa kalau dah tengok Lesung Batu ni dah boleh agak lah siapa. So another men's health practitioner who's been in the field untuk jangka masa yang lama juga. So alright. So sebelum saya introduce dia, kita nak beritahu beberapa benda sikit lah. So men's health ni selalunya orang kaitkan dengan mati pucuk, dengan pancuk awal dan sebagainya. Tapi sebenarnya men's health ni ada lagi banyak. Dan considering that November is men's health month, so we thought okay, berapa lama lagi nak bincang tentang mati pucuk, berapa lama lagi nak bincang tentang pancuk awal dan sebagainya kan. So ada banyak lagi yang kita nak bagi tahu, banyak lagi yang kita boleh speak about and delve in. So antaranya adalah isu-isu performance, isu-isu penggunaan pil suplemen dan fertility dan sebagainya. So let's not waste time. So let me introduce Dr. Roland Victor.
Hello, how are you, Deeban?
I'm good sir. How are you?
Bagus.
Alright,
Masih melesung.
Alright, so anyway, thank you for coming in and we'll to discuss more on men's health, especially on men's health month this November.
Betul,
alright,
betul,
fine.
Betul.
So I think memang kita dah banyak bincang tentang mati pucuk dan sebagainya lah kan. So orang semua dah tahu okay, mati pucuk tu apa, risiko apa semua. Tapi yang banyak yang orang tak tahu ni, men's health ni lebih kepada, ada juga bahagian fertility, ada juga bahagian performance, hormonal health, okay, psychological health dan sebagainya lah. Okay, so I think to start off with, okay,
apa topik kita hari ni?
Okay, so topik pertama yang saya nak bincang, yang kita boleh bincangkan hari ni lah. Okay, so
kita akan ada beberapa topik kan?
Yes.
So ini bukan, this the first part.
Yes, this is only the first of many. So let's start off with the first topic. Okay, so basically I titled it this way lah: steroids, supplements and shortcuts. Are men pushing their bodies too far? Okay, adakah kita lebih kepada penggunaan steroid, suplemen dan sebagainya untuk support performance kita? Okay, so what do you think?
I think kalau kita lihat dari segi penggunaan steroid, suplemen dan juga macam pelbagai jenis produk dan juga, memang lelaki hari ni, what I would define it like the old term, metrosexual.
Okay.
So lelaki-lelaki yang moden ni dia dah mula amalkan upstyle wellness.
Okay.
So
maksudnya,
bila kita lihat pada isu hormon ni, memang akan diuji ataupun dia akan tertanya pada dirinya, adakah hormon-hormon lelaki saya ni mencukupi? Okay,
so maksudnya dia dah lebih performance driven lah.
Yep.
They are not accepting the fact that okay, kalau macam orang kata orang tua-tua dulu, okay dah tua memanglah lambat sebagainya, so they are not accepting the fact lah.
Betul.
Okay, so kalau tengok macam tu, do you think there is a big market for health, for muscle building supplements, steroid usage among men today? Is it a very big market?
I think we have to look at it in a more ke arah yang positif.
Okay.
Whether the penggunaan ni berdasarkan pada keperluan, the need for them, and also dari segi macam hormon, penggunaan dia dari segi direction yang ternyata selamat.
Okay.
Because kita tahu isu yang kita bila cerita tentang masalah hormon, we're going to know that there's this black market hormone.
Yeah.
The black market hormone is the one yang kita risau because kita tak tahu dari mana sumber dia. Kita tak tahu keperluan dos and ikut nasihat siapa.
Yeah.
Adakah ikut nasihat kawan-kawan sekitar kita yang akan cucuk dekat bilik persalinan gym? This is the fact.
Orang kata bro science lah. This is bro science. Alright. Okay, so of course penggunaan hormon and supplement ni, okay, dia either it will help you or it also has its risk factors lah. If you don't do it properly lah kan. Okay, so in your practice, what are the side effects or what are the negative impacts that you see dalam patient?
If you're looking at usage of supplementation or hormones, I think it's dua benda berbeza. I think I'm going to start with hormones first.
Okay.
So sekiranya lelaki yang muda, they want to try hormones, we need to see, okay, what's the reason and purpose.
Okay.
That you cannot deny that certain industry or certain kind of sports use a lot of the synthetic hormones.
Yeah.
One, especially the bodybuilding field.
Yeah.
Okay. It's impossible to grow that fast.
Yeah.
Itu satu benda yang kita tahu. Kalau saya ataupun Dr. Deeban hari-hari pergi gym pun and tak ambil apa-apa barang, macam ni lah badan
macam
kita.
ni jugalah. Ni dah maximum potential.
Tapi kalau ambil, wow, it's like you see the transformation like 6 months, 1 year, like how did you get jacked up that fast?
Okay, so if I were to extrapolate that, you tengok bodybuilders, kalau bandingkan lah bodybuilders in the 30s and 40s when it first started lah kan.
1930s
1930s. Okay, 1930s and 1940s when bodybuilding was gaining a lot of traction at that time. And compared to like people like Ronnie Coleman, for example, Arnold Schwarzenegger when they were competing, there's a clear-cut difference. So would you say that these people actually used all the synthetic hormones and all that to achieve, or it's completely achievable, or is it achievable without supplementation?
They will not want to admit it.
They will not want to admit it. Exactly. They will not
unless we test their blood.
So there is a possibility that
there's a possibility there, of course. And in fact, like we wouldn't even know. Mungkin dalam even in the experimentative phase of the early 1900s, there was so much of scientific discovery also.
Yeah, true.
I'm pretty sure that chemists and all these biotech people who existed were experimenting on this.
True.
And
it
it
still
was
goes
so
on.
hush.
Yeah, and it still goes on up till today.
Yes.
You still have newer drugs coming in, improving improving things lah.
Correct. And then bila rujuk pada isu nutrition pula, we must understand that there's the knowledge yang pengetahuan kita ada tentang nutrition today is way higher than what we had 100 years ago. One, of course, they had better quality food, but they had lesser information.
Yeah.
We have good information, but poor quality food.
Exactly.
So
actually, we do have good quality food. It's just that which is easier. The question of which is easier. So
accessible,
which is more accessible. Exactly. So okay. So other than that, what about psychological issues in patients who yang terutamanya yang pakai hormone performance enhancing drugs, BEDs lah kan? A lot of psychosocial issues that we see. Is it driven by a psychosocial issue by itself?
I think it can be in both directions. One is there's also this body dysmorphic issue.
Yeah.
Orang lelaki yang mungkin muda yang baru lepas remaja, they feel like kenapa badan saya sangat kecil bandingkan dengan susuk badan orang Eropah ataupun African and everything, they are like so chisel and build. Kita ni semua macam keding je. Okay, itu satu issue. And then we look into like excessive usage because they feel that I just want something very fast, nak cepat sangat.
And more is never better lah.
Correct. So mereka akan pergi cari sos untuk cucuk dan sebagainya, and mereka akan buat dengan seperti katakanlah bro science lah.
Exactly, because a lot of them when they use this, there's not much of research, there's not much of understanding. So tak faham macam mana benda ni akan berfungsi, tak faham kalau terlebih guna apa yang akan jadi. And I've seen a lot of patients yang crash testosterone crash and all that because of overusage, because of unscrupulous usage of testosterone.
Because they like what they feel at the start. It's so addictive.
Exactly.
And then they feel I want more. Can I try A and B and C
together?
Mixture.
Yeah.
And
they'll come up with their own cocktails.
Cocktail yang dahsyat. And then apa yang berlaku is kadang-kadang this thing juga boleh melibatkan sistem pembentukan hormon dalam badan sendiri pun jadi rencat.
Yeah.
That means signaling daripada otak you kepada buah zakar dah tergendala, and then size buah zakar terus kecut. Sehingga benda ni akan beri impact kepada individu tu pada ketika mungkin proses dia ada relationship, berkahwin dan sebagainya, ataupun untuk reproductive health, untuk sistem pembiakan, semua hancur. And that is the saddest situation. Itu bagi saya ialah paling sedih, because why? They didn't know what was coming.
True. But how much of this, like, usage of performance enhancing drugs, unscrupulous use of hormone, how much of this you think is directly related to social media or influence from social media? Does that play a big role in today's world?
It does. I think impact for social media, like if you can compare, like 10 years ago, we didn't have Instagram.
Instagram is the biggest
so it's
influencer
just very
now.
visual.
Yes,
because see,
exactly.
If you describe and cerita to people tentang ni lah ni video, ni lah ni, inilah tu, they don't understand.
True.
But you understand that physical attraction of puffed up muscle. It same goes to female.
Correct.
It's like nobody's going to ask like this hot supermodel online, and like, can I know what makeup you use? Which eyeliner? L'Oreal? This one? That one? It doesn't happen. So the same thing goes to so what they see to the nearest counterpart dalam gym, well, this guy can lift this much lah. He's already like so tuned, and then he rips off his shirt. I want to be like that guy. I want to be that guy.
What's the fastest way to be
fastest way?
Yeah.
And then he said, you want to know the secret? Come.
Backdoor injections. Alright. So okay, social media, peer influence, banyak yang menyumbang lah. Okay, and then of course poor understanding as well. So let's say someone really wants to build muscle per se. What is the safest way without harnessing? Is there a foolproof way, or is there a good proper way of using these hormones to enhance?
Okay,
or in a way, let me rephrase that. Is there any benefit in per se optimization of their hormones, or when it's already, or let's say it's already normal?
Okay, kalau if we're going to see, kalau kita lihat dari segi hormon lelaki ataupun perempuan, and we're looking at the optimum peak, kita kena first understand that we are humans. There is an aging process.
Yes.
First, we have birth, childhood, teenagehood. Now they got in between tween, and then we have this after puberty phase.
Yeah,
okay, that is most likely your peak lah. Mungkin daripada umur 25 hingga 30 tu memang your peak. You see it in athletics. Kita lihat dari segi player bola sepak, tengok performance.
It's all 20s to 30s lah.
Yes,
at the
we
most.
can see that, except for Ronaldo. Okay, so when you see that happening, then you realize that okay, of course, these hormones pun ada role play there. Okay, so can we improve or not? My answer is yes, you can improve, but you need to be guided, or you need to have cukup knowledge to play with something. Knowledge, don't play with fire.
Yeah,
it's like
true.
you really like leave the danger to us situation. And another one more thing is keselamatan. Sometimes yes, setengah therapy dekat Malaysia, I personally feel hormone therapy is expensive because we don't have a competition in the market. We don't have products that can compete for a better price. Bandingkan dengan negara Thailand or India or any other country, even in Europe, they have a variety.
Yeah, I think in Malaysia the problem is compared to other countries. So in other countries, yang I nampak lah. So patients who come, so people who come in seeking for advice or consultation from overseas, like that, their level of understanding in human hormone function in regards to their own health, okay, jauh berbeza. They are more. Sometimes they might know even more than us, I think. But today with globalization, I think information is always at your fingertips.
Yeah.
So it's just a matter of time how much can we develop our knowledge. But coming to pricing and product availability, I think Malaysia is still behind lah in terms of optimization, in terms of bringing in multitude of products to help a multitude of people. But coming back to the question of, so we mentioned that peak performance is 20s to 30s, right? Okay, so if someone, let's say for example, we take it bodybuilders lah. Okay, so would you say that if they were to bodybuild naturally in their peak at 20 to 30s, they would get more benefits, more muscle mass per se.
Definitely more benefits and muscle mass.
Okay, but would that mean that if someone wants to start at the 30s to 50s, should be looking at hormone optimization?
I wouldn't want to say yes to that. I mean, they can consider, but we need to also understand their life journey, because I think
Yeah.
their life journey situation is very, very important for this phase also. Because if you give a scenario, ada orang datang umur 30 tahun, don't have kids, not married, and say like, look, I want in the next 3 years I want to go for bodybuilding competition, and I am considering seriously to use
Hormones,
some
yeah.
whether it's mainstream hormone or non-mainstream hormone. Okay, then the question you ask is like, okay, what do you see? Are you willing to take the risk of certain issues?
Yeah.
Whether what's your job nature like, kerja you macam mana, whether you're going to have a hypertension, whether you are ready for.
Are you ready to face the consequences?
Yeah, and then if you have subfertility issues or you have mood swings, and then whether you are in a relationship or not, all of this kena ambil pertimbangan also. I mean, again, it's the right of the patient to know what's the possibility of all of this. And then you have another guy maybe say like, dude, I have 5 kids. I want to go for this competition.
Yeah.
And I don't care.
Yeah. So
see, the answer will be different.
correct. Everyone's
Yeah, so
it's based on
so
their
when
needs.
people ask us online kan for advice, I tell you need a consult, because your health journey too is your own journey.
Correct. Berbeza dengan orang lain.
Yeah,
So
maybe I would have something different.
Yeah.
Dr. Deeban will have a different perspective of things. It's very different.
So it's never a one size fits all kind of approach when we talk about hormonal usage.
And what do you
optimization.
think about then a more senior category of people datang? Okay, I want to try hormones. Can or not?
Okay.
Especially men, and we know that the hormone testosterone akan mula turun dah.
Yeah,
When they're coming in the 5 series and so on.
When they're coming in the 50s and 60s, again lah, similar approach would be what is your need. So apakah tujuan yang you nak optimize your hormone? Are you unhappy with life? Sebab sekarang ni the problem is, kalau berbanding dulu lah kan, 50s 60s is retirement age. Alright, so your energy levels naturally decline because you dah tak perlu function that much. But now it's completely different. People at 50s and 60s are still considered productive members of the society. So there's still a lot to output. So when to me personally is, I see it that, okay, when they have so much to give, and now they're having a trouble in terms of energy levels or talk about functionality, then yes, and they have proven biochemical reduction in certain hormonal values, then I see yes, it makes sense to optimize, but only because there is a need to, only because there is a shortage. Your body is not doing it for yourself enough, so we optimize it. But personally, on a personal note, I don't see any benefit in reaching supranormal levels. So if let's say he's 50, but his testosterone utilization, production everything is normal. Okay, for men his age, he doesn't have any symptoms of issues. He comes in buying that notion. Okay, kalau I naikkan lagi, it's better for me. I think my approach would be no. I'm a bit conservative that way lah. So I would say no. I don't think you should increase it, because you might feel good in the beginning, but you are asking for more trouble later on. I think that would be my approach. So it's always on a as of need basis, and only if there is an indication to use it.
True. I totally agree with you. I memang sokong and setuju sangat-sangat, because some people pada umur 60 tahun dan sebagainya, saya akan tanya mereka, how fit are you?
Correct.
And why do you need this? Are you going to the gym 3 times a week, or you're just retired playing with kids at home?
Yes.
Because if you bagi satu individu yang mungkin ada 5 cucu yang berlari-lari kat rumah, and he's like, I want my testosterone every day. You know what's going to happen? The rotan only going to come out. So that nurturing aspect of being like a granddad ataupun atuk tu akan hilang.
Because I think that's the other thing is they always look at physical improvement. So you cucuk testosterone, your tenaga bertambah, your stamina bertambah semua. Tapi people don't look at the psychological aspect. So your aggression is also sifat agresif ni datang daripada testosterone juga. So lebih banyak testosteron, lebih agresif. Perubahan sikap, kemurungan boleh or depression can happen either in very high levels of testosterone or very low levels of testosterone also.
But this issue of this anger management, I think it had a bad impact on testosterone therapy itself.
Yes, correct.
Because the media yang memang hantam, I feel the woke culture of Europe and America hit this point very hard. Like, if you've got high T's, that means you're
an aggressive,
you're an angry man, that kind of thing.
But okay, that's not the we know
yeah,
that
we know it.
We know
but you
it's
see,
not,
see, this is the thing that also sometimes discourage some couples, more senior couples, and say, should I try? No lah. The wife might be objective. Like, I scared that you will be very. Angry. But if she's on a menopause position, if she gets cortisol up, no problem.
Straight away, hormone replacement therapy. Which okay, so I think in a nutshell, kita boleh simpulkan bahawa kalau wanita dapat hormone replacement therapy sebab ada keperluan, I think men can also consider that. But to do it properly under guidance, only if there is a need to.
Betul. I think that is very important. I mean, you see certain technology, walaupun bagi saya, I think it's always going down to cost, I realise. Because benda ni masih baru dalam masyarakat kita. Because for Malaysian market is tak apalah, dah tua. The slapstick thing, dah tua lah bang, jangan kacau saya lagi lah. That's the thing. So you take means now what's my problem? Now it becomes my problem. Now what you gonna do? So and it's always been focused on testosterone, always so much focus on hubungan intim. Tapi function of testosterone jauh melampaui daripada hanya tu. So even like issues dari segi sakropenia, susut otot and everything. Tapi dengan syarat kalau kita bekalkan pun, you kena buat some form of exercise
lah, correct.
To get the
So
muscle
you still need to do your work lah. Don't hope on the hormone per se. Okay, so I think so that brings us to our second topic. Okay, which is performance pills in the bedroom. Okay, so basically PDE5, call it whatever you want lah. You want to call it ubat kuat, ada orang kata jamu lah. Okay, as doctors, pil perangsang, kita bagi kita bagi ubat-ubat kuat lah sebagainya lah kan. Okay, so there is this notion yang kalau dulu orang yang tua-tua, orang yang lama-lama dulu tak pakai pun pil, anak beranak 5-10. Okay, sekarang lelaki semakin banyak guna, betul ataupun tidak?
Betul, sebab dulu dia ada pokok tongkat ali kat belakang rumah. Tak adalah, gurau je. This is, kita nampak di satu dunia sekarang. Okay, peratus hormon lelaki dekat dunia memang merunduk. Dari segi kesuburan pun memang drop.
Okay.
Tapi kalau kita lihat kepada kenapa 100 tahun dahulu lelaki boleh dikatakan lebih aktif, paras hormon lelaki mereka tanpa sebarang ubat pun jauh lagi tinggi, bilangan anak yang mereka ada pun jauh lagi tinggi daripada ini. So it's, bagi saya, it's a market forces. Okay, one is the lifestyle telah berubah. Dulu kita jalan, sekarang kita bawa kereta. I remember the stories that macam atuk saya kata, dia akan jalan daripada Sentul sampai ke what's this? Masjid Jami. Every day. Okay, that one without highway pun jauh. Yes. Sure kan. So every day, they would do that. Okay, how many kilometers they cover? Tak payah 10,000 steps. True. So the metabolic burn rate is already very high. So that means to say that kenapa? Okay, contoh kalau kita sebut tentang ubat kuat lah in the bedroom for erection dan sebagainya lah kan. So maksudnya physical activity dulu semakin lebih banyak. Satu sangat tinggi. Okay. The next point I like to highlight is the stress. Kalau kita lihat, mungkin orang dulu mungkin gaji mereka mungkin RM500, RM700, and mereka boleh menampung satu keluarga. Sekarang ni kalau you 10x benda tu pun kadang-kadang masih tak cukup dekat bandar. And mereka, they were not in the chase for a lot of things yang bersifat duniawi. Okay, I don't need 2 kereta, I don't need to have 5 houses. If I work hard for 1 house, it's good enough. Game for them. So bila benda-benda ni, all of this harta or assets kan, you put you into this debt brain. Like how to settle. So biasanya tanggungjawab tu akan balik pada lelaki. So it's very ketua keluarga lah kan. So the sympathetic stress in the nervous system memang akan buat lelaki ni always feel macam okay, dia macam balik kepada sifat hunter-gatherer dia. I got to hunt, and I got to protect at the same time. So female characteristics akan pergi kepada nurturing instead.
Yep.
So that's increasing the sympathetic drive. So in terms of dari segi hubungan intim bagi pihak lelaki is parasympathetic. They need to be calm, they need to be contented, they need to be relaxed. So now it's that, and they always had that assurance that the opposite gender, pihak isteri dia, had always protected, guarded the house. We are living a situation that we have to have most likely 2 breadwinners to God. Kena ada 2 orang yang bekerja.
But that's also because our lifestyle has changed. So everything around us semua dah berubah. Kita like you said, we chase benda-benda yang duniawi, become more materialistic. Something is never enough for us. So do you think that so in a way, in search of perfection or more things, in search of more a more stable environment, we have actually become more stressed, less healthy compared to our forefathers lah. And that has contributed a lot to our problems.
And despite thinking about that, the baby boomer, pre-baby boomer generation technically live in a situation of a World War I and World War II environment.
Which you would imagine
it's like
lagi
crazy,
banyak stress.
Yeah, crazy. You think about it, like when they cerita tentang the British ruling and the Japanese occupation. Like, can you imagine that if that is happening now? In this environment, how stressed men would be.
True. I mean, true. But even given that, I think because their lifestyle was so much simpler, and then taking again the baby boomer,
they don't have to do a podcast like this.
True.
They probably just sembang
sembang kedai kopi.
Right.
But nice topic. I mean, nice name for the next podcast. Sembang kedai kopi. But yeah. So I think so in a way you agree with me if I say that modern men feel there's a lot more pressure to perform lah. Would you say that?
Yes.
Okay.
And that thing, if I relate to the psychological perspective of the female gender in all the social media game, you see, if you are female, it's a very different scenario online.
Sorry,
if you are a female, situation there very different online.
Okay.
You get lots of attention.
Okay.
Males don't get a lot of attention online. You and I know for a fact.
Yeah.
But if you are a female, with whatever we do, my God, the DMs might come in. Okay. So, but no, don't send me the DM. I'm not going to reply.
Yeah, we don't reply. Sorry.
But what I'm saying is, you see, like where do males get their rapport? Where males get their respect?
Okay.
So because you see, we're not even having this kind of quorum that all our grandparents had that chit-chat session, or whether it's a religious, pergi surau ke, pergi temple.
Yeah, I think over time we've become very private.
Yeah, so it's like you go, you come back.
Yeah, true.
Last time it's like, you know what, you all stay at home, I'm going to have a chat with my buddies here, play dumb, and then come back.
Yeah, so
and nobody's going to question.
Yeah. So now I think, in a way, kita dah tak bersama dengan orang-orang lain. So sharing of knowledge is of course limited. Kita dah tak ada tempat untuk meluahkan. I think because men especially are egoistic creatures, so it's very difficult for us to even speak about any of these things with people openly, with the family members. So I think kalau dulu ikutkan, any stress is all relief with a group of friends.
True.
So now that doesn't happen because we're always chasing after something. So so when someone uses this kind of performance enhancing drugs, like for example lah PDE5s and all that, unscrupulously, alright. So tak tahu dia beli saja, beli dekat Shopee lah, friend bagilah, okay. Are there?
I like this thing when you say friend bagi thing.
Selalunya lah kan, my patient
try ni.
Kawan saya bagi. So dia kata okay, jalan. Tapi saya tak boleh lah ini. Okay. So what are the negative things that can happen? Like in terms of health, in terms of other things besides health, the negative aspects of using medications like this.
Okay. So kalau kita lihat pada PD5 ni lah antara ubat-ubat yang memang kebiasaannya berdaftar yang diperlukan prescription daripada doktor. Tetapi malangnya banyak produk-produk ni memang boleh dapat dekat pasaran gelap and everything. And then orang beli secara murah.
Yeah.
Okay, so kadang kita tak tahu pun dos dia. Mungkin
That's
ada
the biggest problem.
Yang mungkin dos standard yang kita bekalkan 100 mg ke 50 mg ataupun 20 mg, tapi dos yang di bawah pasaran yang gelap ni 300 mg. So dos yang terlampau tinggi. And then kita tak tahu, mungkin individu tu ada masalah penyakit saluran darah ke,
masalah
jantung ke, ada migraine ke, mungkin ada impending stroke ke dan sebagainya. And then dia cuba because they already feel okay, something quality erection tu tak bagus. So they will start to hunt for this kind of option. Okay, dan mereka cuba. Dan sekiranya apa-apa berlaku pun, nanti mereka akan pergi ke kecemasan pukul 3 pagi, saya sakit jantung, saya sakit. Tapi nobody will actually tell I took this
medication.
Mereka takkan bagi tahu. So the doctors pun feel like, oh, it's a straightforward cardiovascular issue, mungkin angina dan sebagainya. So ini benda kita hari-hari tengok kat klinik.
I think okay. So kepada penonton di luar sana, okay, kalau you nak beli ubat dekat Shopee ataupun you nak kawan you bagi ataupun you nak ambil jamu, benda herba yang dikata menjamin erection yang bagus dan sebagainya, tahulah bahawa bahan-bahan apa ni, whatever yang you ambil, jamu ke ubat, herba kopi ke apa, semuanya ada ubat yang sepatutnya diberikan oleh doktor, yang ada dos yang spesifik. Okay, so kalau you beli dekat luar tu, okay, kebanyakannya dah dicampurkan ubat-ubat dah macam ni, dan kita tak tahu dos tu macam mana. Kita tak tahu bahawa anda sesuai ataupun tidak untuk ambil ubat-ubat ni, so anda menempah padah. Okay, so kalau nak pakai, kita tak cakap ubat tak bagus. Okay, ada keperluan, tapi ikut nasihat doktor.
Betul.
Tengok keperluan tu, okay, dos berapa banyak you nak, you sesuai ataupun tidak nak pakai ubat tu, buat secara berhemah. Do it properly. Don't just simply take medication and then you will be in trouble later lah. Okay,
and so sometimes kami pun sebagai doktor, ada kadang-kadang dos yang kita bekalkan kadang-kadang tidak mencukupi ataupun lebih daripada cukup. So then we tell patients, okay, I think we need to step down. Sebab erection ni sampai 2-3 hari pun ada. Okay, so what we're trying to say is, bukan kata ubat tak berkesan, tetapi there are some form of side effects that can happen. Tapi it doesn't mean semua orang akan ada side effect ni. Okay,
and not side effects at all doses. So that's why as doctors kita pun bagi ikut dose, and we can know what are the side effects yang boleh berlaku, and we can manage that, we can anticipate that.
Kita tahu apa nak buat.
Kita dah tahu apa nak buat kalau sekiranya berlaku lah. I think okay, so that's one thing. And then of course ada juga patient yang I think another myth out there is, oh, kalau saya pakai ubat ni nanti saya sakit jantung, saya rosak buah pinggang. The best part is, saya pernah banyak sekali saya dengar sakit kata, saya ada kencing manis, kalau saya makan ubat kencing manis, buah pinggang saya rosak. Okay, so I think these are all myths that need to be broken out there lah. Okay, so yes, some drugs can cause the side effects, tapi bukan semua. So anything, fall back on your doctor, ask, okay, does this really happen? So that's that. And then of course,
when kita, if you talk about that, just jump in and jump out. Saya juga faham that kenapa masyarakat luar sana have this perspective, disebabkan oleh interaksi mereka dengan pengamal perubatan. Katakan kalau 60% of the population is dependent on public service, sistem perkhidmatan kesihatan awam. The maximum time mereka dapat 3 minit.
Betul. Tak cukup masa untuk kita
kita baik jemput mereka datang ke podcast.
Exactly. Sebab tu kita buat podcast. So you can relax back and listen. And long form.
It's long form. At least you faham that kenapa sometimes kita ambil. But as usual lah, bila traffic dalam sistem perkhidmatan awam tu terlampau, too many people, traffic tu,
it's jammed up, it's sesak. So memang okay, so kalau doktor dekat situ tak dapat nak huraikan, tak dapat nak explain, okay, jangan segan silu, jumpa dengan doktor lain, tanya pendapat, dapatkan fahaman yang betul lah, okay, tentang ubat-ubat yang diberikan.
Betul.
Okay. So berbalik kepada performance drugs dan male performance lah kan. Okay, so if someone wants to improve at the moment lah, okay, feeling okay, I dah tak perform macam dulu, okay, I dah ada masalah macam ni kan. Okay, instead of medication, dia tak nak pakai medication dulu, okay, what are the things that they can do to improve? What do you think that can be done? That's within their control.
I think the big word, kalau apa yang improve, is actually improve their discipline.
Okay.
As guys, I think lelaki, I think paling penting is one thing is discipline. Disiplin dari segi pemilihan pemakanan, gaya hidup, bersenam, your restriction on tobacco, dan juga alkohol ataupun apa-apa benda-benda yang recreational punya stuff, makanan ubat ke suplemen ke apa yang terlarang, you want to avoid it.
Okay.
You want to avoid it because that is your mantra. So kalau you tak berjaya nak handle all of this and terus nak quick fix and terus pada masalah ubat, fungsi ubat tu takkan tahan lama. Because the other masalah is just brewing. Dia hanya tunggu time je. And then masalah kencing manis akan datang. Bila masalah kencing manis datang, sistem saluran darah tak bagus, kidney ada masalah, liver ada masalah.
So you akan have complications of that. Yep.
So I think kalau ramai yang come to see people like us pun, they think that fixing masalah kesihatan lelaki ni is uni channel. Satu je ambil ubat ni terus fix. Ni bukan antibiotik. This is a lifestyle change.
Yes.
I
think the most important part is semua orang rasa okay contohlah I dah ada masalah ni, I makan ubat ni dah terus baik. Okay, tak semestinya. Not all problems can be solved with a medication. Not all problems are curable. Bukan semuanya kita boleh baik pulih. Menambah baik boleh, bukan membaik pulih. So nak elakkan komplikasi ni, tukar gaya hidup. Itu yang paling penting lah. So tukar gaya hidup dari like what Dr. Roland kata tadi, pemakanan tukar. So eat clean, don't eat or possibly minimize your trans fat or your processed meats. If you smoke, stop smoking. There's no difference in reducing cigarettes and
even all this vaping and
and vaping as well. So there's nothing to say that if you kurangkan you menjadi lebih sihat, tak ada. Kalau you merokok, you tetap merokok. Tak kisahlah you merokok 100 batang ke, you merokok 1 batang ke, efek sama. Alright, so stop. Okay, then of course exercise. Exercise because now in a more stressful environment, kita hidup dalam keadaan yang lebih stress, lebih banyak masalah yang datang disebabkan stress sendiri. So you have to de-stress in some ways. Find time for yourself
and get also good sleep.
That's the most underrated
therapy.
That's the most underrated therapy. Good sleep. So how would one define good sleep? What would you say is good sleep for someone?
With all our technologies and wearables semua sekarang kan, I think we've managed to look into sleeping like in another level. How deep light sleep semua dapat. Bagi saya very simple lah. Kalau orang yang kerja yang office hour macam pukul 8 pagi sampai pukul 5 ataupun 9 sampai pukul 6, I think if you can get into sleep by about 10:30, 11 o'clock, it's very good. And then probably get up at 5 o'clock or 6 o'clock for your press and then get the day ready. Sama you ada anak-anak nak hantar ke sekolah ke, I think it's quite a perfect time. The failure we have today is if you finish work at 6 and then you're running back. If you have kids, you and your wife works, you kena pick up.
Yeah.
Lepas tu balik rumah, lepas tu tapau makanan kat luar, and then you're already at 8 o'clock.
Yeah.
And then you got everybody settled at home first. And then you have to eat.
Yeah. And by the time you actually go to bed,
shower, and then by the time like 10 o'clock, and then you tell yourself like, seriously, it's already at 10 and you're telling me to sleep at 10:30. No way, I want to de-stress myself, or I want to watch TV, or I want to watch. They want to binge on news. So it's not easy. It's easy to be said, like what I said. It's like the perfect chemistry of timing. But when you put yourself in the reality of the current day man or woman, they want to have that some form of calm down position. And this is not that even tengah berfikir orang ada intimate relationship at that time.
Yeah. This is just you. This is your me time per se.
Exactly.
Yeah. So it's very difficult lah. But I mean, it's always something to try, something to always strive for.
And one thing. We had our conference last month, and one subject I discussed is planetary medicine. And one interesting study that I went through was how the liver has its own clock.
Okay.
And the liver clock, kalau you pergi rembat liver clock ni secara tak betul, and you work on wrong timings, it holds back a lot of toxins in the body.
Okay.
So you know like
it actually makes you
hormones
sicker lah.
make you sicker.
Yeah.
So if you're not sleeping by between this great window of about 9:30 to about 2 a.m, you lose that recovery time. Itulah time masalah budak-budak kita semua keluar makan, lepak,
Betul.
pergi club, lepak kat warung, balik pukul 2. So this is the things that you attribute lah. Memang when you are umur awal 20-an, you boleh buat lah.
Yeah.
Tapi cubalah buat ni masa umur you 30-an, 40-an everything, then you are mencari masalah.
So berbalik kepada even topik testosterone or hormone tadi pun, everything has its own clock. So even like testosterone has its own clock. So a lot of men yang masuk, dia ingat okay, testosterone dia sentiasa tinggi. Kalau dia muda tu sentiasa tinggi. Tak semestinya. Okay, so testosterone has its yang kita panggil variation or periodic variation or diurnal variation jugalah. So maksudnya dia akan naik pada sesetengah waktu sahaja. So contohnya awal pagi, then sepanjang hari tu dia akan menurun dan sebagainya. So lack of sleep pun akan memainkan peranan dalam menurunkan hormon-hormon atau menjejaskan fungsi-fungsi hormon inilah. Alright, so then berbalik kepada just because you tak tidur, tak cukup tidur or tak dapat tidur yang berkualiti, then you dapat masalah-masalah hormon tunggang langgang, masalah-masalah lain, kesihatan lain. Punca masalah ialah tidur. So it's very underrated, but I think everyone just learn to sleep properly lah. Okay, set a time just for you to get proper good rest, and you can avoid a lot of problems even by then. Alright. Okay, so the one of the most topic that I personally am interested is fertility in men. I think it's very underspoken in Malaysia especially, sebab kalau kita bincang rawatan fertility dan sebagainya, semua orang akan fokus kepada perempuan. Yes, exactly. So kalau pasangan ada pasangan yang tak ada anak 2-3 tahun dah cuba semua memang still tak ada, okay, isteri pergi check dulu semuanya. Okay, so but topik tentang fertility untuk lelaki, I think banyak yang tak dibincang. Okay, so antaranya, so today I think kita nak bincang beberapa, we'll probably break a few myths as well, and then kita bincang lebih lanjut lah. Okay, I think one thing that men yang semua orang akan percaya ialah, semua orang ingat ialah, okay, lelaki bila-bila pun boleh dapat anak. Betul ke? Can father children at any point of time?
Theoretically, yes lah.
Okay.
Theoretically, yes.
But realistically?
Whether they can afford.
Okay. True. Okay, in today's world, that's another question lah. In today's world, having 5 children is not affordable.
Yeah.
Okay.
It's a practicality.
It's a practicality issue. But okay, fine, I agree. Theoretically, yes. Lelaki bila-bila pun boleh. Okay, so but is there a difference in age of the men when they father children? So contohnya in terms of their offspring lah. So kalau masa contoh lah, kalau you umur 25 tahun and then masa tu you ada anak, you dapat, you have a kid, and then compared to when you are, let's say, 50 years old and you have a kid, the health status or how would be a man's fertility at that, in those two instances?
Okay, the study shows apparently there is no significant difference. Tak ada beza. But I want to look we look into the quality of life. Whether post delivery and stuff. One, you're old, you cannot support and stuff. One. Second thing is we also look into the fitness of individual.
Okay.
Kesihatan lelaki tu secara keseluruhan. Kalau memang dia lelaki yang fit, dia cergas and everything, let's just say like he remarries at the age of 70 something with a younger female, and they have an offspring, he can afford everything, then fine lah, there's no problem. He can secure.
Okay.
But if you're talking about someone who's got all the impending cardiovascular diseases, then that doesn't mean you're not going to have an offspring. Masih mungkin you boleh menyambung zuriat and stuff like that. Tetapi like I said, like quality wise, apparently the study shows there's no difference.
But lately, of late I've been...
This is opposite compared to female.
Yeah, female is the opposite. That's proven lah. So female have what do you call it? It's a biological clock. Yeah. So after a certain point of time, they are call it, because they are only born with that certain number of ovumes and all of that, eggs and all that. Right, fine. So but of late, I have been seeing a lot of patients, young patients, among 20 to 30, the most productive phase in their life. Okay, but they are coming in with reduce fertility. So when we do like macam kita buat semen analysis dan sebagainya, jumlah sperma dah berkurang, semua jumlah kita panggil motile sperm yang boleh berenang sebagainya, quality dah berkurang sebagainya. Okay, what do you think is contributing to all of this?
Kalau kita lihat dari segi kesuburan lelaki, faktor yang menyebabkan ni, one is memang quality makanan. We have a big topic is about microplastic.
Yeah.
That's maybe perlu 2-3 hari tu cerita pasal benda tu. Then we have also another issue of the xenoestrogens yang berkait dengan all of this pemakanan kita, yang banyak sangat pesticide, walaupun orang fikirkan mereka vegetarian tapi lagi banyak pesticide mereka consume. And benda-benda ni secara tidak langsung dia merencatkan the sperm quality. And couch potato lifestyle, duduk tengok binging watching movie, tak adalah keluar untuk bermain bola ataupun bersukan and everything, nothing, very because like I said, balik pukul 8 at home lah.
And of course I think we are also more exposed to other habits like smoking is one big contraindication. So smoking will affect your fertility no matter how much we want to deny it. Kalau kita nak buat argument, dulu datuk saya dia rokok sigar, tapi anak 10 orang. Yes, probably. But sekarang memang tak. You are exposed to cigarette smoke. You are exposed to more pollutants from the day you are born. Kalau dulu, yes, dia rokok sigar, tapi
dia pick up the thing. You lahir dengan
you dah lahir dengan tu. Dia pick up at maybe when he was 15-20 years old, and he lived in an environment that was less polluted. Betul. So it's not just the smoke that you inhale from the cigarette, it's also the smoke in the environment. There are environmental pollutants that will also affect your quality of sperm.
Another one more thing I wanted to add is the social structure of lelaki yang murung and also the consumption of pornography yang sangat banyak, that they have excessive tabiat onani dan everything also menyebabkan like certain signal hormone macam prolactin semua terlampau tinggi. And dia macam,
so back to hormonal imbalances lah because of certain lifestyle decisions yang dia buat. So ada hormone. So fertility ni bukan sekadar just ambil tengok kandungan sperma sahaja. Dia pun bersangkut paut lah dengan paras testosteron, paras hormon-hormon lain dalam badan. So there are other issues yang contohnya seseorang tu boleh ada testosterone deficiency katakan, disebabkan oleh faktor-faktor tertentu, and that affects a man's fertility as well lah. So merawat fertility saja tak mencukupi lah.
And kalau kita lihat dari segi cellular level, one thing is kita kena lihat pada satu komponen nama dia mitochondrial health. So this segment ni dalam dari segi macam regenerative medicine and everything, dia sangat banyak dibincangkan lah. Macam mana kita nak improve the mitochondria punya function, because itulah macam the battery of your cell. So the sperm cell merupakan sel yang paling kecil sekali dalam badan tubuh lelaki. So kalau sel badan dia secara keseluruhan, dia ni malas, tak workout, muscle movement tak banyak, tak ada otot, they don't do anything to trigger their muscle and everything. So the cellular cells all over the body pun akan pergi kepada isu demand and supply. Kenapa aku nak buat? Sebab kalau kau duduk macam tu je.
True.
So technically the body will say like, go into a decay position lah. I don't need to do so much. I don't need to produce a lot. So I'm going to keep all these guys so lazy as I can.
Because there's no need. There's no need.
And then kalau pemakanan tak bagus, all the tools untuk pastikan bateri ni betul-betul kena charge tak ada, maka you akan dapat lah sperma yang betul-betul immotile, sperma yang bergerak dengan perlahan and everything.
So in that sense, would you recommend someone to do a fertility check as they get older?
As they get older? Why do it when they're older?
No, as in like if someone gaya hidup dah macam ni, dah gaya hidup yang tak sihat dan sebagainya, would you recommend someone to do it? Would you recommend someone to check?
My joke biasanya lawak yang saya buat dekat my patients is, lain kali kalau nak pergi resek orang, minta dia buat sperm test dulu. Hantar dulu ni. Calon ni sesuai ke tak? So you know what's coming.
So I think
ini macam dah dowry soal kabel.
True. So I think so in a way bila kita bincang fertility ni, bukan perempuan sahajalah, lelaki pun boleh bermasalah, dan selalunya banyak juga yang lelaki yang sperma yang bermasalah. Dan I think to answer back the same question, to check or not to check, tepuk
think
dada.
it's good to check.
Yeah.
It's good to check. I think especially macam couples yang sekarang ni kita hanya ada saringan untuk HIV and everything, right? It's good to check that you don't put the blame game after the marriage.
Yeah, true.
Satu. Kedua is at least they know what they need to work out. They know how they feel, how they look, and they must be willing to take whatever consequences.
So you mean to say that do it before you actually embark on marriage per se lah. Alright. So that's a bit controversial. I don't think how many people would actually do it. Okay,
they're already doing it.
Oh, they're already doing it. Yeah, true. But I think but I would say tepuk dada tanya selera lah. Kalau you memang dah tengok gaya hidup you tak sihat, merokok dan sebagainya lah kan. So then you pun tak dapat anak, you cuba, and then you don't want to blame yourself. It's very difficult to actually accept blame. But you have to start somewhere. So I would say if your lifestyle memang dah tak bagus and there are already telltale signs yang okay you cuba tapi tak ada anak dan sebagainya, get it checked. There are ways that can help. Okay, there are medications, there are therapies that can work to improve. There are things that you can do lah. Okay, but coming to things that they can do to improve fertility, what would you say? If you had to give a few.
For men.
Yeah, for men.
Untuk lelaki kalau nak tingkatkan kesuburan, again, it's going back to the basic principles. Your movement, senaman, sleep again,
yeah.
food again, going to be the thing. And also have a very good social abstract of life. Maksudnya apa tau? That means your world order. I call it the world order lah, of your brain, of your philosophy must be also fixed dengan some decent moral backgrounds, religious backgrounds, society, and you must understand like your role play as a man. The possibility of you possibly meeting a future partner, benda tu akan wujud. Do you want to protect the integrity? It's a big thing, but I think we have already practiced benda dalam all our cultures. Whether it's Malay, Chinese, Indian, all of these things are the core building of this Asian civilizations, the Asian societies. But this thing semakin lama semakin tiris. So we went too socialized, we went too open, we
basically did everything excessively,
excessively, especially on like media binging, all of this. So abuse, and then it eats you up. To the psychological, the body says like, why you need an offspring?
Yeah, no, but it says you by yourself is a waste of nature per se. Sorry to use that, but yeah.
So it's like nature is so sometimes I feel very intelligent to
compared to us.
Respond.
So when we talk about fertility and all that, right? So of course we always also have to look at how much does like hormonal back to again hormonal function. How much does this influence testosterone? How much does your hormones like for example, let's take testosterone for example. How much it influences your fertility and all that? So globally, do you see like with more patients, more men becoming subfertile, younger? Do you actually think that more men are having lower testosterone?
It's already proven.
Yeah.
We are having a
so that is the
decline.
trend generally lah.
We are having proven in the past 50 years we are downtrend. Elon Musk kata by 2050 we can pupus.
Because we just are not producing enough.
But I'm confused like why he's also creating the AI robots. Or he's preparing that.
He's preparing it lah. So in a way, yeah. So of course, so you also see testosterone deficient.
We are already seeing down. That we see that dalam I kind of see this very deep. Kita lihat dari segi leadership globally. We see that we have no choice to pick weaker men to lead. One.
Is this in any relation
everywhere,
to the
everywhere
US?
I'm still happy MAGA won lah. Okay, that's one thing. And then we also have this hate against masculinity and ada woke culture yang sangat-sangat extreme. And there's always a lot of pretext towards favoring female rights, but there's nothing about male rights.
Okay.
That's the idea. So day by day you are technically exposed to this. And you just understand like the days when there were strong men, countries were stronger. They were physically able to challenge narratives and fix the problem. Today it's like don't talk. If you rather brush it
Brush it
down.
aside, yeah.
So that creates a weaker society. That's why you see people are not able to stand up for right things and stuff. So that is already the symptom, because low testosterone is technically a response of a weak hunter.
Okay.
If you want to go hunt, you are better hunt or you be hunted. And you can see this. We can see this. How many people go to the gym? How many people are fit? How many people can make boardroom decisions today? Can make good political decisions? Can do right things? And when you see that is down, then you know already. Nobody's giving any rapport or respect to weak men. And females can sniff this because testosterone is in the air. It's true. This is how our situation is at the moment. So bila kita lihat this issue, it starts small, but it's actually a huge problem. It's not like just down there. It's like all over the place.
So globally we are looking at okay. So the trend is where you see testosterone is actually on the downtrend, and we are like, okay. So I think.
You know that we have more males having higher estrogen component.
Yes, exactly. So I think a big misconception is that testosterone, men with high testosterone would be like you said, strong leaders doesn't mean aggressive leaders, doesn't mean impatient leaders. No, it's a quintessential alpha male that we are talking about, that would be able to make quick, independent, proper decisions and safeguard everything else.
Yes.
Okay. So there's a big misconception there also. They think that, okay, if you improve your testosterone, you're looking at improving your testosterone. Okay, that's just going to make you that what do you call as a chauvinistic male. No, that's not the point. So you want to be stronger in all ways, in all aspects. Okay, so yes, globally we do see that coming down. But if someone has to start in today, I would still think that the starting point is always going back to the basics. Okay, so improving your lifestyle, your food, your health, training. I mean, of course, giving your body more work to do, aka exercise. All right. And of course, a proper stress-free environment, a proper conducive environment,
and the mental peace lah.
And the mental peace of it. I think that would help with improving back your testosterone levels before we actually need to intervene lah, or before you actually look for medication outside lah. All right, fine. I think with that, safe to say, I think today we can conclude. Okay. With our topic on men's health. So probably pada masa yang akan datang kita akan merujuk lebih banyak topik yang berkenaan dengan kesihatan lelaki bersama saya, Dr. Deeban dan juga Dr. Roland.
So sehingga kita bertemu di episod yang akan datang, kita lesung kau.